Brian Hine is here and has some important information about the Camp Lejeune. I don't want to call it a lawsuit, but it's going to turn out to be that way. So Brian asked if he could have a couple minutes of our time, and he's been very helpful with things. And we'll turn the meeting over to Tom right now. Or Brian. Why did I get Tom? Get Brian to fill us in on what's new. It's all yours, Brian. Good morning.
Good morning, Commandant. Thank you for inviting me to speak and allowing me to speak. Good morning, everyone. And Steve, I don't know if it's I'm available to share my screen, but if so, it might be easier to pass along the info that I have for the folks.
You should be able to share it.
Great. Great. So give me 1 second, folks. Oh, it says it's disabled. That's okay. So if that's fine, I could just talk to folks for 10 minutes. We're kind of in with respect to the Camp Lejeune litigation. Many of you folks may have remember me from about a year ago coming and talking to you and explaining this Camp Lejeune litigation and what a Marine or a potential claimant would have to do in order to bring a claim to seek justice. Right now we're in crunch time. So
share your screen now.
Okay. All right. Let me share my screen.
But he's in Vegas. He went to Vegas for the weekend for his birthday. So yeah.
All right.
But yeah.
Let me know if everyone can see. Is that up, Steve?
Yes, sir.
Okay. So this is, let's consider this part 2 of my presentation from a year ago, right? We're going to talk about the Camp Lejeune Justice Act. Just as a brief disclaimer, I'm just giving information today. This is not legal advice. This is not an advertisement for me or my firm or anything like that. And this information, as you may remember, is not just for Marines. We're going to be talking about the surviving spouses of Marines. We're talking about other services that or service members outside of the Marine Corps who may have been at Camp Lejeune. I want to make it different from my presentation that's on the YouTube channel, in that really I'm just, because we're in crunch time. Basically, we have effectively less than 8 months left to file claims under this, unless there's a change in legislation. And because you may remember the statute of limitations is 2 years from when the Pact Act went into effect. That was August 10, 2022. We're now coming up to August 9, 2024. And if you reverse engineer that, you probably need a few months to get your paperwork ready. Our Marines should be getting their stuff filed, their claims filed by probably May, to be realistic and to be safe to not violate this cutoff. Now, again, this is not, I want to talk about, to focus today on all the misinformation that I've been hearing over the past few years going across the East Coast talking about this with folks. This is not, the Camp Lejeune Justice Act provides protections to family members of deceased service members and Marines. Okay, even if that Marine passed away 10 years ago, all right, and the normal statute of limitations would have passed by now, this legislation opens the door for that family member to start a claim. But again, I want to inspire you folks to get action. You're the leadership here. The leadership at the detachment level should be hand-holding and guiding their troops to ask them, hey, have you done something with regard to this? Do you qualify? And, if you're going to do that, if you want to do this, let's, vet counsel together and try and get you filed before this cutoff. Another bit of information or misinformation is that people think that if they don't have a tier 1 or tier 2 condition, that they can't file a claim. That's not true. It's not just for tier 1, tier 2 illnesses. Okay, those are the VA presumptively linked conditions that the VA has on their website, and I'll get into that in a little bit. Another bit of misinformation. People think that if you were to be rewarded money for a claim, that it affects the money given to our active duty Marines that are currently serving. That's not true. Okay, that's a separate pot of money. It doesn't affect them. I'm gonna talk about offset again, because I think in my last presentation I misinterpreted a question that Donna had. So I want to make it very clear. And I'm gonna talk about the new elective option program, which is the first settlement overture that the government has made for victims of Camp Lejeune contamination. And the first thing I want to talk about, the biggest bit of misinformation or misunderstanding that I see is the two separate tracks. And what do I mean by the two separate tracks? There are two separate tracks. We'll consider them railroad tracks, right? There's a legal track and a VA track. What I experience a lot, dozens of times, I've had dozens of conversations where Marines come up to me and they say, "Oh, I'm covered under Camp Lejeune. I filed my claim, my legal claim. I went to the VA, I spoke to a VSO, and I filed a claim at the VA clinic." That's not true. Okay, they're two separate tracks. You go in to the VA to file a claim, right? We use this term claim loosely in both sense. You file a disability claim to receive disability percentage and monthly benefits, right? And you can do that with the help of a VSO. A VSO, I understand, speaking with several of them, that they do not handle legal claims, okay? So the legal track is separate. So you have to go at the detachment level, make sure that people aren't relying on going into the VA clinic to handle their legal claims. They're two separate things. They kind of work together, but just because you went into a VA clinic does not mean you fulfilled your legal track claim. So that's what I'm talking about today. All right. There's a difference. The legal track is for pain and suffering and wrongful death damages. All right. And you may need an attorney to help because a VSO is not going to help you with that. All right. One of the other bits of misinformation is that people say, well, I don't have a tier 1 or tier 2 condition, so I don't qualify. That's wrong. Okay. I have the VA presumptive conditions are listed there for you folks. Okay. Those are the tier 1, tier 2. That's leukemia, aplastic anemia, bladder cancer, kidney cancer, liver cancer, multiple myeloma, non-Hodgkin's lymphoma, Parkinson's, kidney disease, and so forth. All right. Those are the tier 1, tier 2 conditions. And currently there is a settlement program for those conditions. It's called the elective option program, which I'll get to in a few seconds. Below is a list of other diseases that the U.S. government agency for toxic substances and disease registry acknowledges may be linked to the contaminants that were at Camp Lejeune. It's a much longer list you can see. Okay. In bold, you'll see cancers. Okay. So just because people they say, oh, I don't qualify as a VA presumptive condition, tier 1, tier 2, that doesn't mean that they're out of luck with respect to this. So make sure that, they have to have a serious medical condition. They don't define what serious is. Okay. There's a lot of serious conditions that we probably all could brainstorm and think about. So make sure that you're holding the hand of those Marines and you're asking these types of questions. All right. The first settlement overture that the government has made so far with respect to these claims is called the elective option program. It's for tier 1 and tier 2 folks. It's a very limited settlement program. You can Google search the elective option program and you'll find the guidelines for how to go about trying to settle these types of claims. They're very limited in that it's only about 5 pages. It's a 5-page read. It's only for those who filed an administrative claim. Okay, you may remember from my last talk, that's this first step before filing formal litigation. You have to file an administrative claim with the Navy JAG. You have to have a tier 1 or tier 2 illness, and you cannot fall outside of what they call the latency period. That means that if you've contracted a disease after 35 years of being at Camp Lejeune, you do not qualify for this program. Okay. There's rumblings that they're going to expand this program and make it, available to tier 3, tier 4 folks possibly, and for those outside the latency period. But right now, this program offers depending on the amount of time they've been at Lejeune, depending upon the condition that they have, between $150,000 and $550,000. Okay, they have a matrix, and it's a very easy read. It's about 5 pages. I encourage you all to take a look at it. But that's real money that can help. That's life-changing money that can help folks. So we need to make sure that we're holding our troops' hands, explaining this information to them, and making sure that if they qualify, or if we think that they can qualify, that they're taking the steps in order to try and get some sort of justice. I also wanted to briefly offset, since my last presentation, I think Donna asked me a very important question that I may have misheard. So I apologize, Donna. I think I've talked to her about it in the past. Since I want and this is, again, when I talk to folks, this is one of the big questions I get, is the offset. That if you have VA disability benefits and you are successful in the Camp Lejeune claim process or the litigation, formal litigation, what does it mean by to offset? Coming right from the statute, says any litigation award shall be offset by the amount of any disability award payments or benefit which relates to exposure to Camp Lejeune. So I think, I'll give you a hypothetical example to illustrate this, in that the government does not want to pay twice thing. They don't want you to double dip. If you have John Doe Marine with 100% disability, and 20% of that 100% relates solely to Camp Lejeune water exposure. Okay, that's 20%. The other 80 relates to his back, his knees, whatever. Agent Orange, okay? Only focusing on the 20% that relates to exposure at Camp Lejeune. If he received prior to the litigation, $100,000 for that 20%, and then he is later awarded $500,000 at litigation, he would have to deduct the $100,000 from the $500,000, and he would get a lump sum payment of $400,000. Okay, that's the other money that he received for the 80 is not factored into that equation. The second bullet point here really gets to, I think, the heart of Donna's last question, which was, what is that? What else may be affected? The offset does not affect the claimant's overall disability percentage. So in that example, Marine walks away with $400,000 lump sum after the $100,000 deduction. That Marine maintains 100% disability rating, can still get the same health benefits at the VA clinics now that they receive now and in the future, get the same healthcare benefits, and it does not affect that Marine's ability to receive other VA benefits from other programs. Okay, it also, again, last bullet, does not affect the money going to other claimants who may be filing. There's no cap on this fund set aside for Camp Lejeune litigation. Okay, it's not that you're taking away money from someone who's more deserving, and it does not affect the money that's going to our active duty Marines so that they could serve. I put on here at the bottom, you don't have to take my word for it. You can go to the VA website. Okay, go to their frequently asked questions at this URL at the bottom here, and you can see for yourself that I'm not. You can take the government's word for it. All right, on that. That is, I think I was given about 10 minutes. I hope I stayed within that timeline. Commandant, I'm happy to address questions either now or anytime. Here's my information again. You folks can call. I just ask that as we're in crunch time here, I just encourage people to get action, help your troops, and do a little hand holding and guide them through the process. Thank you very much.
Thank you, Brian. Any questions for Brian? As long as he's here, he's been gracious enough to give us his time on this issue.
I do.
I have a question.
Go ahead,
Go ahead,
Dave.
Donna.
I was just going to ask so that I understand this correctly. This is just a one-time lump payment, and then people go on to getting their disability as before.
Yeah,
Is
I
that
mean,
correct?
it's,
Okay.
I think you're right. It most likely it's going to be a lump sum payment. Of course, with a settlement agreement between you and the government, this is again, why I think retaining counsel is helpful for people. And that if they don't have experience negotiating settlements with the Department of Justice, then you could probably work something out that if you want payments spread out over time. But I think it's probably you're guaranteed to get a lump sum, and I would probably say that most people would opt for that.
And then is this, excuse me for saying this, but is this tax-free?
It is not tax-free. So
Aha.
that I would think that most people, if they were to get money, a large sum of money like this, they should probably reach out to their accountant and talk about what does that look like in terms of a tax issue.
Thank you.
Dave?
I have a question. I know there's a cutoff for filing this year. What about Marines that served at Camp Lejeune but do not have any of these illnesses yet? Is there a way to file to protect yourself for future illnesses?
Yeah, that's a good question. There is not a program yet for those who don't have a serious medical condition, but may be fearful that they're going to contract something in the future. There's no program for that. We've the folks down in North Carolina in the federal court, as well as people on the Hill, have been trying to see whether or not there will be any protections for those types of folks. But the Eastern District of North Carolina, the court there has not entertained the idea of what you're speaking of, called medical monitoring, where you would file a claim and then monitor that individual to see if they ever contract something serious. There's been no the court has given no indication that they intend to do that, despite being asked. So currently the answer is no, there's nothing yet for that.
Hey, Brian, I have a question.
Yes, sir.
Tom Arcuri, former department commandant, past department commandant. In that slide that you showed with the tier 1 and tier 2, the second paragraph, serious medical conditions, that does affect me. And my question to you is, do I need to file anything to protect my right?
I think that if you have, I don't want to get into specifics, right? And if you have specific questions about your case, I'm happy to talk to you offline. But generally, right, if anyone falls within that second list, and I know that this is being recorded, so that you folks can look at that list again. That second part, serious medical condition, that's not an exhaustive list, meaning that you could possibly think of something else that's serious, and then potentially, meet your burden of proof for this claim process, this litigation process. So to answer generally, Tom, if anyone has something on that list, I think they have a claim, provided they also meet the timing requirement at being at Lejeune, right?
Right.
There between 1953 and 1987, and then be there for more than 30 days. If that's the case, then yeah, I think that Marine has a claim.
Okay, thank you.
Any further questions for Brian? If I remember correctly, Steve puts this up on the department website. Brian's contact information will be there. Am I correct?
Yes, sir. It will be, after I edit it and Brian approves the edit, it'll go up on our YouTube channel.
Okay,